So essential tremor is a neurological disorder. It's very common. It's the commonest of all the movement disorders. Not that many people have it so severely that it disables them from doing everything. It means that somebody can't sign their name. It means that they can't bring a cup of coffee to their mouths. Elias has a severe form of essential tremor and is disabled by it, and that's why he was referred for the high-intensity focused ultrasound treatment.
It's very intriguing. Obviously, the idea of neurosurgery in an awake patient without breaking the skin is revolutionary. Getting through the skull in particular, it's one of the most difficult areas to get to with ultrasound. So the procedure is really quite interesting in that we acquire essentially routine structural images, and then we apply the focused ultrasound first in lower intensities. So we're able to heat it just a few degrees above normal temperature. And while we're doing that, we actually produce images that are temperature maps. And so we can see exactly where we're heating. And it turns out that heating, if you heat to a high level, you'll burn and destroy the brain tissue. But if you heat to lower temperatures, you can actually produce a temporary physiological effect. So not only can you produce the temperature maps and see exactly where you're heating, you can actually interact with the awake patient and see the physiological response associated with changing that precise bit of tissue.
On the morning of the procedure, he comes in with his hair shaved, but then we repeat that shave after I've given him freezing all the way around his head. Then I put the frame on his head with 4 pins as low as possible, and then essentially a very tight rubber holder goes around his head, which will then allow the water to completely bathe his head, because ultrasound, of course, can't go through air, it has to go through the water. Then he goes into the MRI machine and spends 4 to 6 hours in there while we do imaging. And then we start making test lesions where we ask him whether or not he's feeling something when we apply, as we increase the intensity of the ultrasonications.
In my own vision, this is sort of the beginning of a much larger research platform. So there are some things that we begin with immediately, such as essential tremor in terms of treating, and patients will benefit immediately. And then to start investigating other potential treatments, and really to see them come in and sort of lie in the MRI scanner and 2 hours later get up and walk out and take a drink of water and sign their name it's impressive. So it really is life-changing for them. And yeah, that's extremely gratifying.